video, I'll be demonstrating a electronic patient management software that I use in my practice. I was asked by a few colleagues of mine to show them what I use, and the program that I use is Opendental software. It was made by a dentist actually, Jordan Parks, and it was made by a dentist for dentists, so it's a brilliant software. I love using this software. Just a bit of a disclaimer: I'm no in way a representative. I'm not affiliated with the company, and I'm not earning a commission. I'm just demonstrating a software that I use. So when you build up the software, it comes down to the first thing is the appointment feature here. If you're going to enter a patient, let's say if a patient is known to my practice, the first thing the database does is it searches to see if the patient already existed. So let's say if it's a new patient that was new to my practice, first thing I'll do is search, and it showed me that the patient was not in the database. For simplicity, I'll just add, I won't enter all the other bio data for the patient. I'll just enter the date of birth, and you can see it automatically calculates the age for the patient. And I will say OK, and we'll come into the main charting, which is what I'm going to demonstrate in this video. So let's say if the patient came and he was missing 2 teeth, and he wanted some bridge work done, so we'll chart that those 2 teeth was missing. Let's say his forehead was also visually impacted, so we'll move it a little bit there, give it a visual tip. You can see that so beautifully, so easily I can manipulate the teeth movement. And during the treatment planning, the patient asked me to make him a bridge, so we place 2 retainer bridge retainer crowns, PFM crowns, on those 2 teeth there, and 2 pontic to replace the 2 missing teeth that he has. Bridge pontic there, and we also charted that he had gross caries, which was irreversible, and we were going to extract that. So yeah, and after doing the treatment planning, we then went ahead and did 2 visual incisal filling on his 2 central incisors. And yeah, you can see the color coding is for each of the different procedures that we have done for the patient. So you can see, and everything that was charted in the 2 chart has been displayed on here. So for this video's sake, to keep it short and simple, I just did a very simple charting for a patient. In the next videos, I'll demonstrate how I capture patient images, which I do quite a lot for my ortho patients and current bridge and cosmetic patients, and how I also use email feature to capture or discuss with patient treatment plans and communicate with them. So everything happens from within the software platform: emails, capturing patient photos, x-rays, letter writing, sending prescriptions. You can do all those things from within one software. And if anybody wants, in later videos I can show you how we do detailed tooth notes, procedural notes, and setting up each different feature of the software. When you buy the software, you just buy a shell of the software. You'll have to tweak and customize and do all the entries on your own, including setting up the emails, setting up letter forms, letter writing, prescription writing, which is what I enjoyed mostly with the software. So those I'll do in later videos. So thanks for watching, and I hope you make up your mind on which software to get, and I would really highly recommend Opendental for anybody's practice. Thank you.